Here are the 5 telltale signs of black fungus. The first telltale sign that you may have a fungus infection is if you have a swollen eye or cheek, you may have pain, swelling, redness, or numbness. Black fungus can land in your sinus tract because it's a moist area as you inhale, and it can burrow through not only your skin but your bone and then actually go up to your brain. So that's why it's really important, if you feel like you have more fullness on one side, that you should really go get that checked out. Now, when you go to the physician, we have multiple things that we can do. We can image your face with a CT scan or an MRI. We can also take samples, and an ear, nose, and throat surgeon can go in and take a look to see if there's any symptoms of fungus. Sometimes this can be so aggressive that it makes the outside of the tissue black, or the tissue maybe in your palate black. So it really depends on where this fungus is invading. Number 2, if you have fevers, please be sure to see a physician. Fevers by itself is an inflammatory, very normal response against stress in your body. Oftentimes it is caused by some kind of infectious disease. And I usually don't encourage people to suppress their fevers unless they are super uncomfortable or over 103, because fevers is protective. That's your body's way to protect yourself. However, if you have any fever, you should talk to your physician just to make sure. Number 3, if you have any breathing issues, coughing, chest pain, shortness of breath, especially if you cough up blood, means that your respiratory tree is irritated and it is a moist environment for germs to live. So make sure that if you have a persistent cough or any respiratory symptoms, that you go and see a physician to go get that checked out. Number 4, any place on your body that turns a different shade of color, like black, is not normal, so that you should go and get that skin area checked out. Sometimes it's just a really dark clot. Other times it could be an infection, especially if it's accompanied by redness or swelling. It may or may not be painful. It depends on if the tissue is compromised already, right? So like people with diabetic foot infections, oftentimes they have no pain because their nerves are already dead. So they can't feel that there's something wrong. So this is why it's important, if you see something wrong with your skin, that you go get a professional to check that out. And number 5, if you're having persistent headache, if you feel like maybe your loved one is altered, something is just not right, please go get that checked out. Black fungus is actually very, very aggressive. It can cause mental status changes. It affects your consciousness. Sometimes you may not be thinking right. Sometimes you may have personality changes. So whenever you have any of those questions, please see a physician to make sure that it is not something that we can treat and help you with. Because early diagnosis not only prevents complications, but sometimes it could really be life or death. As you can see, black fungus can invade a variety of tissues and cause severe destruction. It's really best to avoid black fungus, so here are ways in which you can minimize your risk. So fungus like to grow in dirt in moist areas, as well as to spread in the air. So on a windy day, try not to go outside if you're at high risk. I live in California. We have aggressive Santa Ana winds that cause a lot of dust and disturbance in the air. So I try not to go out during those times. Sometimes if you live near a construction site, you also want to be more careful because they are disturbing a lot of the earth that creates a lot of the dust where the fungus live. If you have to go outside, make sure you wear an N95 mask that's sealed tight, as well as soon as you can, wash your hair, change your clothes, and wash your glasses. If you are immunocompromised, please consider not having any live plants at home. Plants are a great hangout for fungus because it's a moist, wet environment. In addition, I eat a lot of fruits and vegetables, so oftentimes I keep my fruit outside to allow it to ripen. But if you're immunocompromised, you really may not want to do that in an enclosed space because fungus can grow. Have you ever seen like the hairy black stuff that grows on rotten fruit? Yeah, well, that's black fungus. That is what you can inhale, and it can infect you and cause everything that I listed prior. So this is why you have to wash your produce before you eat it. And when even though you can't see it, it's still on the produce and the fresh vegetables. So I recommend that if you are going to eat fresh produce and vegetables, you keep it in a plastic bag in the refrigerator. And then you take the whole bag out, you bring it to the sink, and gently don't, open up the bag without first putting a little bit of water in it to make sure that you kind of weigh down the fungus that's kind of in the air or on the produce, because when you disturb it, you can aerosolize it, and that's how you get infected. It's really by inhaling it in. So everything you do should be to minimize the spores from getting up your nose and in your respiratory tree. But if you're immunocompromised, you should reduce the amount of fungus on your produce. So I generally, if you're really severe, I tell people to at least flash boil to really avoid eating anything raw. And unless someone else can peel it, and then flash boil it to make sure that it's safe. When you wash your produce, washing by water will decrease one layer of fungus as well as pesticide. If you wash with vinegar, that will decrease another layer of germs as well. And for those who are super high risk, it's best to not wash your produce indoors. And if you can have someone help you to wash your produce for you outdoors, that would be best. Of course, if you see any black furry spots, you really have to get rid of that, but you don't want to disturb the air. So I usually recommend people gently cover it with a damp cloth or a paper towel, I should say, because you want to throw the whole thing away. And you don't want to just throw it away. You want to gently place it in the trash can and gently cover the bag to throw it away. Because whenever you lift a trash can, pay attention when you pull that handle and shrink the trash bag, you actually aerosolize and jet up air from that trash can to your nose. And that's one way how you can get yourself infected. You may want to wear an N95 mask if you are immunocompromised, or have somebody else take the trash out. Just like if you're pregnant, you don't want to handle cat litter and have your spouse do that. Same thing with this trash can and being exposed to black fungus. My sister-in-law, actually, she keeps a small bag next to her sink, and whenever she has organic material, she puts it in and then wraps up that small bag and takes it out every day. And this way, it's disposed of on a daily basis outside of your living quarters. And make sure that you're not rinsing your nose or your sinuses with tap water, because it is not 100% clean. I also caution people on eating leftovers. Everyone has their own comfort zone for eating leftovers. Just know that fungus is in the air, and when you leave your food out, spores will land, and it's a moist, wet environment. Even though it's in the refrigerator, germs will still grow. It may not grow as fast. Everybody should have a HEPA filter by this time. If you don't, if you're immunocompromised, it is a must-have tool. You should have at least one in your kitchen and another one in your bedroom. It would be best if you can put them in multiple rooms everywhere that you tend to go to really circulate and clean your air. Now, the bathroom is one place that black fungus wants to go because of mold, and it sometimes grows on the ceiling where the air rises, and then you can't reach to clean, right? Especially in the corners. So this is why ventilation is key. You want to open your windows. Sometimes the bathrooms have really tiny windows, so then you may need a fan to help circulate that moist air so that you decrease the amount of time that fungus has to moisture. The reality is you can try your best to avoid black fungus, but unless you live in a bubble, you will be exposed, right? So here is where taking care of yourself can make a huge difference in your resilience to minimize your risk of disease. So even if you're at higher risk, it doesn't mean you can't improve how your immune system responds to stress. So here are 5 simple steps that you can do to optimize your immunity. First thing is to sleep well. Sleep at least 7 hours a day, every day, more nights than not, and try to get sleep before 12 o'clock midnight. Number 2 is to always keep well hydrated. Your body needs water to defend yourself, for the machines to work. So if you don't have water, you won't have blood flow, you won't get your soldiers to where it needs to go when you have a stressor. Number 3, eat foods rich in antioxidants, really foods with whole fiber. And fiber will jumpstart your gut microbiome to help decrease bad inflammation as well. So this is where eating this daily actually can power your immune system to be more resilient to things like black fungus and everything else that we have to deal with in life. Number 4, avoid processed sugars and really poorly controlled sugars. So fungus do like to eat sugar, and the way that your sugar levels go high is if you're eating a lot of processed sugar with a lot of fat. And reducing both of them will improve your blood flow, improve your immune system so that you won't have bad inflammation that suppresses your immune system. And number 5, eat lots of beans and leafy greens. They are vital nutrients to support your immune system and your body. They are filled with fiber, potassium, magnesium, and a whole host of other nutrients called polyphenols that optimize your immunity. I hope you found this video helpful. If you did, please join me on my next video. See you there.